The COMBI-i trial is exploring how to combine targeted therapy, Dabrafenib and Trametinib, with a new PD-1 drug called Spartalizumab. So how to combine targeted therapy with immunotherapy, anti-PD-1. So COMBI-i, there are 3 parts to it. Parts 1 and 2 are being presented at ASCO 2019 this year. And it looks at the first 30, it's over 35 patients and how they've responded and the durability of that response. And what we've seen is that only 1 patient had progression as a best response. The rest had either a good partial response, complete response, and or stable disease. In fact, the response rate was 78%, which is very high, even for Dabrafenib and Trametinib. But what's more remarkable, and we have to remember it is early data from parts 1 and 2 only, is that the durability of those responses seems to be very good. In fact, the median progression-free survival is over 20 months, and the duration of response is not yet met. We haven't found the median as yet. So this is what we're trying to achieve, is can we make targeted therapy, which is very effective, but patients do progress eventually, can we make those great responses we see with targeted therapy more durable? And so this is early data suggesting, yes, maybe we can. Then part 3 is the important part, which is not being presented at ASCO. That is the trial of the 3 drugs together, so targeted therapy with immunotherapy, anti-PD-1 Spartalizumab, versus Dabrafenib and Trametinib alone. And that will really tell us whether adding in the immunotherapy will improve the durability of response. There are some issues with toxicity, but they've been well managed now in part 3 because we've learnt in part 1 and 2 how to manage pyrexia, which was a problem with Dabrafenib and Trametinib. It's just a little more intense and prolonged with the addition of Spartalizumab. However, with good education on ceasing the Dabrafenib and Trametinib and managing the pyrexia, not permanently, just temporarily ceasing, we've managed to reduce that rate of pyrexia, and it is manageable. So watch this space for the phase 3 trial.